Our next presenter is Dr. Haleem Chaudhary. Dr. Chaudhary's areas of expertise include primary hip and knee replacement, revision hip and knee replacement, minimally invasive orthopedic techniques, computer-assisted surgical procedures, hip resurfacing, and orthopedic trauma.
Okay, so I'm here to talk about hip and knee pain in general. My practice is primarily joint replacement surgery and joint replacement surgery of the hip and the knee. So we'll start with the hip joint. The hip joint is a very simple joint as far as body joints go. It's a ball and socket. So you have the femur down here, and this is the socket or acetabulum. So the muscles around the hip, surrounding the hip are some of the biggest and most powerful muscles in your body. So gluteus maximus is the biggest one, gluteus medius. You have the hamstrings, the quads. So these are big muscles around the hip. The hip joint in general, when you get a problem with the hip, it's hard to get away from hip pain. Everything you do from when you wake up to when you go to bed is going to involve your hip. Any motion, anything you try and do during the day. Moving on, trochanteric bursitis. This is a very common problem that causes lateral hip pain. So when you point to the side of your hip, you got lateral hip pain, doc, it hurts right here. And if you can, especially if you can press in that area and reproduce your symptoms, that is almost always trochanteric bursitis. Now, arthritis is a different thing than bursitis. That is where the hip joint, the ball and socket, where the motion is occurring, starts deteriorating. And it generally has a worse prognosis because once it starts going bad, it pretty much keeps going bad. And there's no way we have of reversing the process. There's treatment for it to treat the symptoms, but the final cure, the cure for arthritis is generally joint replacement surgery of the hip and knee, and nothing else right now can cure it. But hip replacement surgery is great surgery. There's a new anterior approach where you don't have to cut any muscles. We're doing it here. We got a couple special tables upstairs. It's relatively short surgery now. It may take 45 minutes or an hour. Small incision, typically an 8-centimeter incision, about like that. And this provides a fast recovery. You don't have to cut any muscles. I don't put anybody on restrictions after surgery. You don't have to. You can cross your legs. You can sit in any chair you want. There's no restrictions. So, okay, we're moving on to the knee joint now. Knee joint's a little different. Knee joint's more complicated. There's actually 3 joints in one. So knee replacement, 600,000 knee replacements annual, twice the number of hips. Knee arthritis a lot more common, expected to double in the next 10 years. So here's the graph. I mean, we're doing them a lot more. We're offering to younger patients. The surgery is more refined. It's less invasive. It's a shorter hospital stay. It's getting better. And you know, Americans in general and Europeans also, we don't tolerate just gimping around with arthritis forever. I mean, we have a great surgery on for people. There's very low complication rate. So why not do it? So this is knee replacement. This is what the X-rays look like. This is a partial. I love partial knees. I do them whenever I can. When you have arthritis just on the inside, you replace just the inside.